What's up, YouTube? So this video is a lot different than what I normally upload to this channel, but what I wanted to do is, first of all, test out this new camera that I got, and second of all, I wanted to talk about my diagnosis last month with I was diagnosed last month with coronary artery disease, which is a chronic heart condition that I will be dealing with for the rest of my life. And what I've learned since the diagnosis is that someone my age, mid-30s, it's pretty rare for someone my age to contract something like this. So I thought, instead of repeating the story to people a million times, which is what I have been doing, I would just create this video and then I can link people to this instead. Also, maybe there's other people out there that have been diagnosed with it or that are wondering about it. Even, who was it that got diagnosed recently? Bernie Sanders. If you saw Bernie Sanders about a week or two ago, he contracted the same disease and he came out of it okay, just like I did. But if you're curious about it, maybe I can tell you how living with coronary artery disease or living with a chronic heart condition is like, from my perspective, right? So first of all, before I go on, I'll just point out that I have a couple other videos on the channel. I'll link to those in the description, and those go over my trip to the hospital, which was actually in an air ambulance, which was pretty cool. in case anyone's interested, like I said, links are in the description. So what is coronary artery disease? As you can see from my fancy graphics up here, it is when one or more arteries become blocked with plaque. And there's a lot of risk factors that contribute to the increase in plaque being generated in that area and leading to blockages, like smoking or eating a lot of fried foods and unhealthy diet, sedentary lifestyle, things like that. That can all increase your chances of getting this. The reason I have this chronic condition is that my body is a lot more susceptible to those things than the regular person, you know? So just to catch up anyone who doesn't already know the story, I'd say 2 months ago, I started getting some pains in my chest. So this would only happen when I was at the gym working up a sweat. Once my heart rate would get to a certain point, which didn't take long, about 5 minutes on the Stairmaster or the treadmill, and I would start getting these pains in my chest. And for a while, a few weeks actually, I wasn't really worried about it. I thought it was heartburn. That's what it felt like. So I'm taking Tums. I'm just thinking it's no big deal and it'll end soon. But it just kept getting worse and worse. I'd go back to the gym. I'd start working out. I'd feel the pains in my chest. I would stop. The pain would go away immediately. And I'd just go back to it. I would stay at the gym, really. But it got to the point where I would just have to completely stop what I was doing. Stop everything. And then, I would end up cutting my workouts early. It was getting really annoying. So I had a big vacation coming up and I decided to get it checked out. I thought, maybe he'll just give me some antibiotics or something and I'll be good for the trip. Because I didn't want to be out there. I was supposed to go to New Orleans and I didn't want to, have any trouble while I was walking around and doing things. So I went to my doctor. I told him exactly what I'm telling you guys now. And he said, no, that doesn't sound right. So what he did was hook me up to an EKG, took a test. He looked at the results. He sat me down and he said, listen, you need to go to the emergency room right now. So I didn't go back to work. My boss didn't know where I was. I went straight to the hospital here in Bermuda. By the way, I might not have mentioned that. I'm from Bermuda. So yeah, once I get to the hospital, they confirmed what he found. And then, less than 24 hours later, I was on an air ambulance to Lahey Hospital in Burlington, Massachusetts. And I had surgery about 12 hours after that, maybe less even. I can't really remember, but yeah, it was quite the ordeal. It was a little scary, But as you can see, I'm doing good, better than I have been in a long time actually. And as you can imagine, once I got back, people had a lot of questions. Just concern first of all, and then just curiosity after that. So what I'll do here is just answer some of the questions, some of the most common questions that I hear when I tell people about this. So the first question and the most common question that I get asked is like, how did it happen? How did someone like me, young, fit, healthy, how did someone like me get this heart condition? And what the doctor said was that it's hereditary. And I'm not too close with my father's side of the family, but once I heard that, I checked in with him. I called my uncle, um, found out what their history was, and it turns out that all of the brothers on my father's side of the family have heart issues. In fact, my uncle that I was speaking to, he had two stents implanted in his heart when he was my age. So it runs in the family, unfortunately. I can't win $20 on a scratch ticket, but I can win the bad heart genetics lottery. So that's basically it. It wasn't my lifestyle. I'm not a big smoker or anything. I stay in the gym. I eat relatively healthy. I did a few fitness contests earlier in life, and I've always carried that mindset with me. So I'm not 100% healthy. No one is, but I do make sure I take care of myself, and I watch my diet a lot. But when you have bad genetics or something like this, it just happens. There's nothing you can do about it, really. You can manage it, which I'll talk about later on, but that's about it. And the next question I always get asked is, did I have a heart attack? A lot of people assume that's what happened. A lot of my family, when they heard, people were telling them like, "Oh, Omar had a heart attack. Omar had a heart attack." I'm like, no, no, I did not have a heart attack. I was close to having a heart attack, but I did not have a heart attack. So the pains in my chest that I was feeling, that's what they call angina. It's kind of a precursor to a heart attack. Because like when you start feeling this, you really should get checked out. I should have got checked out a lot sooner. But at least I found out and I got the diagnosis and the surgery and everything before it got to that point. So it wasn't a heart attack, but if I would have let it go on any longer, it probably would have become that. I'd have probably had a heart attack and dropped dead. I had a friend or someone that I worked with, a workmate. Yeah, he was about the age I am now. This happened maybe 10 years ago. And he was playing rugby one day. He was a fit guy, nothing was wrong, always healthy, always working out. And he was on the field one day and he just dropped dead, had a heart attack and died. So that would have probably been me, you know? And next question, what was the surgery like? So, first of all, what they did was they went into my heart with whatever tool they were using. Now, it was to analyze how bad the blockage was. So once they got in there, they said if it was just one artery or if it wasn't that bad, then they could just take care of it while they were in there. If it was more than one artery, then they'll have to come out and then we talk about open heart surgery. Luckily, it didn't get to that point. So what they did was they actually entered in through my wrist. I still have a little mark there. I don't know if you can see it, but they went in through my wrist. The backup spot was the groin area. If they can't go through the wrist, they go through the groin, or the leg in the groin area. But anyway, they went into my wrist. They went up into my heart. They saw the blockage. I had one major artery that was 99% blocked. They cleared that out and they installed a stent, which is a little mesh implant that clears the blockage. It opens the artery and it stays there. So you have to take extra care not to get that blocked off. because then you can be in a lot of trouble. So yeah, that's basically what happened. There was no pain, even though I was awake during the whole procedure. They said they couldn't put me to sleep because they needed me to answer questions while they were going in. So I was up during the whole thing. I was a little freaked out when they told me that, but the actual procedure, no, man, it was completely almost completely painless. The most painful part was the anesthesia being applied. So that hurt. That really hurt. It was really short. You just felt a sharp pain going up your arm, and then everything went numb, and that was it. When they were in my actual heart, I didn't feel anything, which was kind of freaky. But what I learned is that you don't feel anything in your heart because your heart has no nerve endings. I learned that, and now I'm telling you. So yeah, if you have, that's why when I was having these heart problems, I was feeling it in other places, and that's probably what throws people off. So if you have any long lasting acid reflux type symptoms, then you might want to check out your doctor because apparently that's a telltale sign that you're having some heart issues. So the more you know, right? So question 4: what's life like after the operation? I can say that for me, because I already live a healthy lifestyle. I want to say I'm already in the gym like constantly. I'm a gym rat. I cook a lot of my own foods, a lot of lean meats and things like that. So it wasn't a huge change, or at least not as big as some people. But there are lots of changes, right? The most significant change is that I'm currently on several medications, most of which I'll be on for the rest of my life. That's it's a bit scary, but you know, it's life. The typical person that's diagnosed with this disease is in their 60s and 70s. So they don't really have a whole lot of life to think about after that. Sorry if that sounds grim, but it's true. Whereas me, I'm like 36. If I live till I'm 80, I'm looking at another 50 years of sucking on these pills every day. But you know, that's life, right? It's better than being dead. So this is it. So just real quick, I live by this now. This is my pill case. I'm actually looking at getting a bigger one so that I can convert this to like a travel case. So this has my 7 days of pills split into AM and PM segments. There's several medications that I take, some in the morning, some at night, and this helps me organize them. This is key. If you ever end up taking a bunch of medications, then definitely look into a good pill case. Uh, my other important document is my continued care photo. So I got this from the hospital when I was discharged. It includes, summary of my condition, medication lists, when to take the medications, how to take them. It includes some imagery from the surgery. If you can see that, you probably can't. If there's any interest in this video, I'll upload this so that you guys can see it properly. And the other big thing is, I guess that's it. Really, I mean, there's a lot of documents in here, but oh, right, it has my implant details. So there's an implant card here. If you have an implant or anything, then I guess this is typical. It's my first implant, so I've never been through this. But it has a serial number, details, and everything, and then a card that I'm supposed to carry with me at all times. I am not big into carrying cards like that, so I made a digital copy and uploaded it to my secure documents app on my phone. So I have it stored there. Um, if you end up going through anything like this, then I think that's the best option because who carries around papers and stuff anymore? You lose your wallet, it's all gone. I leave this copy at home and I take the digital copies with me. So, other than that, like I said, I live a healthy lifestyle already, so I didn't have huge changes to make in that area. However, I did still have to make changes, and I'm evaluating further changes. So, I don't eat all this much. I'm a lot more careful with how much salt I'm taking in, whereas I didn't care before. Um, and on my cardiologist's recommendation, I am currently evaluating a plant-based diet. Something I never thought I would do, but this is a chronic disease, which means that it's something that I can't cure. I can only manage it. So I think a plant-based diet might be a big help. He thinks it might be a big help. He says it's just his opinion, though. If you ask 100 different doctors, you'll get 100 different answers on the subject. But I think that I will evaluate. I'll try it out. I'll try it out and see how it goes. You know. And I also have to check my blood pressure pretty much constantly. I don't have a home kit to do it right now. I will get one soon, but yeah, I try to. Right now, I'm checking my blood pressure like at least once a week. But once I get this home kit, I will check it every day. So yeah, as far as life after surgery, it's basically the same. I'm just a lot more precautious, and I have a strict regimen of medications that I'm on for the rest of my life. All right, that's it, guys. Not much more to say than that. But if you have any further questions or you want anything else explained about this condition, then feel free to leave a comment down below, and maybe even leave a like, maybe even subscribe if you want. Whatever. But I'll be getting back to my regular content after this. I just wanted to throw this up for people that were curious about the condition or about me and why I disappeared for about 3 weeks. So, yeah. Hope to see you guys around, and I'll see you in the next video.